there are dozens, if not hundreds, of mitigation strategies that we're trying to employ as a district to get kids back in our building. I guess something I want to make sure I reiterate is that every school and every district situation is different, and we need to be respectful of that as we move forward. I mentioned the local control. I truly appreciate the guidance that was given by the Department of Education in helping us think through our plans. But I also think we need, a little more guidance in regard to what we do when there is an outbreak and how to respond to that. So something I would ask both the Iowa Department of Public Health and the Department of Education is for clear guidance to help schools, because one thing we've learned with the baseball situation is everybody interprets the guidance differently, and that's led to some issues that maybe didn't have to happen. So hopefully we can get that guidance. And then I just want to end with something my dad talked to me about all the time. He'd always just say to me, all you can do is the best you can do. And as leaders, that's what we're trying to do as educators. So show grace to educators and leaders in your school systems and your districts, because all we're doing is the best we can do. And that's led to some issues that maybe didn't have to happen. So hopefully we can get that guidance. And then I just want to end with something my dad talked to me about all the time. He'd always just say to me, all you can do is the best you can do.
And I appreciate your leadership.
And as leaders, that's what we're trying to do as educators. So show grace
to
educators and leaders in your school systems and your districts, because
non-public schools. So to speak about this from the non-public school perspective, we're joined this morning by Kate Lambert, who is the superintendent of Des Moines Christian School in Urbandale. Kate?
Well, thank you so much, Governor Reynolds and Lieutenant Governor Gray, for this opportunity just to share a little bit about our story at Des Moines Christian. Darren, thanks for hosting. We're conference schools, conference rivals, but I think great collaborators as well, so thank you. It's just a great opportunity for us to share a little bit about our team's work at Des Moines Christian. This spring, the Des Moines Christian school community rallied together at an incredible pace to develop and launch high-quality distance learning with a focus on students of all ages and their continued learning for the remainder of the school year. Our leadership, faculty, and staff demonstrated historic and heroic efforts to continue to serve our students and family. And some of our objectives were to provide mission excellence by transitioning curriculum and instruction to an online format, provide resources and content, and direct support for our students' spiritual and emotional needs, to provide a daily structure and routine for students and families dealing with the crisis, and to provide evidence of learning to students and families. This summer, we have served over 150 students in our summer care program that is operating under DHS guidance and requirements. Excuse me. In addition, we have served several other additional students in athletics, fine arts, and other summer camp programs. Our leaders have worked closely with over 50 teachers and coaches to develop and refine procedures that have helped support our students over the past couple of months. And for the fall, we're moving forward, building on all of these experiences to help provide continuous, high-quality education to our students in a safe environment. In addition to the Department of Education's Return to Learn guidance, we partnered with Baylor University and their Virtual Learning Academy, the Council on Educational Standards and Accountability, and the Iowa Association of Christian Schools, amongst many other organizations, to collaborate with schools all across the state of Iowa and across the United States to create our framework. Our plan contains 4 distinct leveled learning models. The plan will be fluid, but the framework and expectations will be in place so that we are ready to adapt to the changing circumstances to support our teachers and our students. Level 1 is business as usual, and this would represent operations pre-COVID-19. Level 2 is on campus with modified procedures, and level 2 would involve updated campus routines related to learning, attendance, health procedures, including additional precautions in small and large group settings. Distance learning will be available for K-12 students with health concerns. Level 3 is hybrid learning. Level 3 combines on-campus learning with modified procedures, distance learning, and modified schedules that could include alternating days. And then level 4 is distance learning, and that would take our students completely off campus and online. We have communicated our intent to begin with level 2 on campus 5 days a week with campus modifications. To support this plan, our board approved the hiring of an additional school nurse to serve our more than 1,100 students. This is a temporary one-year position to provide additional support for students, teachers, and staff. We also are purchasing PPE for our employees, and we continue to make adjustments and new investments in our cleaning products and procedures to prepare our physical campus to safely facilitate learning. Des Moines Christian is making significant investments in classroom technology. Distance learning this year will look different than it did at the end of the 1920 school year because of our professional development and upgrades in hardware and software that will better support hybrid and distance learning. Devices to record and publish classroom teaching online have been purchased for every K-12 teacher. And finally, social and emotional health is just as important or more important than physical health. Our principals are working with our counselors and partners to support mental health needs throughout the year. The initial and overwhelming response to our communication was excitement and relief on the part of parents, students, and our staff. My favorite quote from a student this summer as he walked back into the school for the first time was, "I will never complain about school ever again." I don't know if I'll hold him to that, but it was good to hear. Our students were created to be together, and the smiles and laughter that we see confirm it. There are still questions and concerns to be answered and addressed, but we are committed to working with our community to keep everyone safe and continue pursuing our mission of equipping minds and nurturing hearts to impact the world for Christ. Thank you.
Thanks, Kate. I appreciate that very much, and I really do appreciate both of you and school districts and educators and administrators and school boards across the state that I know without hesitation are really being very thoughtful and collaborative in thinking about how we can bring our students safely back to school. So I know it's not easy. I appreciate your grace comment. I think we all need to step back and practice that, and we'll all be better off for it. So thanks, and a thank you for your continued efforts, because I know we're just getting started, and if we know nothing else, this is a very fluid situation. So we're going to continue to learn as we move through it. So at this point, we've got a lot of speakers this morning, but it's important. We need to hear from the individuals that are helping frame the decisions and the discussions that we're having across the state of Iowa. So I'd like to turn it over to Director Lebo from the Iowa Department of Education, and then she's going to be followed by Dr. Padati to go into a little bit more detail. Director Lebo?
Good morning. I'd like to start by taking a moment to thank our school leaders who are putting in countless hours to prepare to welcome back students, teachers, and staff in the safest way possible this fall. We all share a common goal of returning safely to school. This work is a collective venture and one that will require continued partnerships between education and public health, families and schools, communities and leaders, and the many valued partners who comprise this important and interconnected landscape. School districts have invested much time and effort in working on their return to learn plans to prepare for a range of scenarios and delivery methods for the 2020-21 school year. As we prepare to return to face-to-face learning in the fall, some school plans will need adjustments, and the department will be active in providing support to those schools throughout this process. Return to learn planning is ongoing and fluid and designed to give school districts the flexibility to ensure high-quality learning continues no matter the circumstances. So as schools prepare to reopen for in-person learning at the start of the school year, they also have the flexibility to provide remote learning opportunities or a combination of both when needed, or if families choose those options. We know this work isn't easy, nor is living with so many unknowns. But we are committed to supporting our diverse community of educational patrons and partners across the state of Iowa, and will continue to work closely with public health experts and other state leaders to support you as we go forward. Thank you.
Thank you. I don't have any children of my own, but children are a very important topic for me because this is what I chose to specialize in as a pediatrician. And I was actually a pediatrician before I joined the CDC as an epidemiologist, and then the Nebraska and now Iowa State Health Departments as a public health professional. And I think all of those perspectives are really important to keep in mind for a conversation like this, because we need to think about, as we've heard, the health and well-being of the whole child, even in a pandemic. Now, unfortunately, we have seen our cases rise over the past several weeks. And like many other states, we've seen this in a young adult population. And even though that's not in our younger kids, it's important to keep in mind that what we know about this virus is that it can move from one person to the other. And so as we've heard from Dr. Kimball and others, it's so important that we all play a role in practicing the public health mitigation strategies now so that we can continue to do things safely, like visit our loved ones in long-term care facilities and get our kids back to school. And of course, as we've heard today, school is just such an important place for our kids, not just for education, but because it's where they develop socially and emotionally. It's where many of them receive critical behavioral supports and get consistent meals. And it's where our teachers, who are also mandatory reporters, are able to help keep our kids safe. And many of you have heard me say in the past that I speak with Director Garcia regularly about how human services can interact with public health and how important it is that we provide these supports for all of Iowa's kids, including our at-risk youth. Now, we know that in order to do that safely, we need to provide guidance and support to our educators, our students, and their families. And I can tell you that I've been working regularly with partners here in public health, as well as with my colleagues in other states, other state epidemiologists, and experts at the CDC to help provide and understand up-to-date and comprehensive information that will inform the recommendations and guidance that we give. And that's going to include, as we've heard, things like promoting behaviors that reduce the spread of the virus, maintaining healthy environments and operations, and having a plan for what to do when we identify a case, which is going to involve working closely with public health to help first identify positive staff and kids and have them sent home or isolated, which is what we do for all sick cases, and then working through assessing exposures and helping provide public health recommendations for those specific settings. And so we know that we need to provide this support and guidance to our educators, our students, and their families, and we remain committed to navigating this going forward. Thank you.
Well, thank you, Director Lebo, and thank you, Dr. Badati. I appreciate the collaboration and coordination. I've witnessed it almost on a daily basis, and I know what's happening when I'm not in front of both of you often, so thank you for that. So finally, as part of our Return to Learn strategy, I'm signing a proclamation today that does the following. First, it directs all state agencies, school districts, and local governments to focus on preparing to safely welcome back students and teachers to school in person this fall. Second, it provides clarity for when a school may move to primarily remote learning so that there's no confusion. It permits remote learning when parents select remote learning as the best option for their family. The Department of Education, in consultation with the Iowa Department of Public Health, approves a temporary move to online learning for an entire building or district in response to public health conditions. A school, in consultation with the Iowa Department of Public Health, as well as local public health officials, determines that individual students or classrooms must be temporarily moved to online learning, or a school chooses to temporarily move to online learning because of, this is kind of another example outside of COVID, but that they move to online learning because of severe weather instead of taking a snow day. So I think with the technology that we're bringing on board through the hybrid, that'll be another option for us to address some of those issues as well. And third, it takes a number of steps to address concerns about our teacher workforce, including removing limitations on how often and long substitute teachers can teach,
expanding the pool of Iowans who are eligible to serve as substitute teachers to include career and technical teachers already in the classroom, paraeducators, and those with an associate's degree or at least 2 years of college courses. And in summary, and there's more details in the proclamation, so I've just briefly hit on some of them, but in summary, we're working hard at the state level to ensure that local school districts have the resources and the expertise that they need to meet the challenges of today's COVID-19 world. So again, I know this is not going to be easy. I know that it's going to require some changes to how things are done in the classroom, but given the importance of education to our children, the people of Iowa, we owe it to them to just roll up our sleeves and get our schools back up and running safely and effectively. And with that, we'll go ahead and open it up for questions.
So, Governor, to the terms of this proclamation,
Yep.
the school that has already said that they're still fully online, Iowa City being one of them.
Yep.
Are they allowed to do that on their?
No, they would have to go through a waiver. Right now, the expectation is, especially with the core subjects, that over 50% of those subjects be offered in the school building. So under some circumstances, they would have to, with consultation with the Department of Education and the Department of Public Health, based on public health reasons, would be potentially given the opportunity to move to that.
Will your proclamation, Governor, have a threshold for if there's an outbreak when schools switch to online?
Dottie, do you have anything you want to add to that?
No, I think I would just echo, again, it's an example of a place, and we know this is hard, but it's an example of a place where we do continue to learn more, right, as a global and national community. And so looking at what we've learned and, what we want to pay attention to with regard to this particular virus and its behavior, those are going to be things we continue to do and support that we continue to provide.
Mm-hmm. Well, yeah, so part of the reason back then there were so many unknowns, as you can all attest to throughout the last 3 months, the parameters have changed and how COVID-19 is spread and how you get it. And so as we continue to learn more about the virus, we have the data and the analytics, and we have best practices, we have examples from other countries and other states that have actually moved through the process that helps inform our decisions here in the state of Iowa based on the data that we have. So at that time, we really weren't testing as many people as we are right now. We didn't have the data and the analytics that we're able to collect right now to really help inform the decisions that the epidemiology team, the doctors, the CDC, their cohorts across the country, every state is grappling with this right now. And so there's a tremendous amount of conversation and dialogue that's taking place to understand what's happening in states and what they're doing and how we can really collect all of that and put the best guidance in place for our administrators and our school districts so that you then can take a look at what's happening in your community and make the best decisions for the students that you serve. So it is going to take all of us, and honestly, as Director Lebo said, it continues to change, and that unfortunately is a reality of COVID-19 and what we've been dealing with over the last 4 months. And so we have to somewhat be flexible and try to do the best that we can. And as I talk to parents and educators and leaders and school board members, that's their goal. Every one of them have the same goal, to do it right, to do it safely and responsibly. But it is imperative, and I would agree with this. I have 10 grandchildren. It's really imperative that we get our kids back in school, and especially those most vulnerable, so we don't leave them behind. And so I think this is the right decision, and then we'll move through it and we'll see, you know, where we have to maybe potentially adjust going forward.
You heard from your superintendent that local control is, critical, and that school districts want local control. A lot of them have already put forward their plans, and now they might have to reassess, get a waiver. I mean, is that not preventing some level of local
Yeah, I think they put forth preliminary plans. I think they were still working on some of the I don't know, Leanne, do you want to address that? I think they're still working on some of the details. And one thing that was made very clear is they would like some more clarification, especially with the legislation that was passed and signed into law, so that to provide some clarification as to what the expectations were from that. It was made clear in the law that if we were going to utilize online learning as one of the 3 return to learn plans, that the governor needed to put parameters in place in a declaration and so in our proclamation. And so we did that today, and I think, again, it's fair, it's flexible, and it really drives the goal, and I think the intent of what the legislature was trying to do through the legislation, and that is that we should all try to focus on getting our kids back in school, that over 50% of the education in core subjects should be in school if possible. Now, if we have an outbreak or there's something that happens, there is a procedure in place for them to temporarily go online. And that's why that component is so important, and that's why a hybrid was put in place, so that school districts do have that flexibility to address a specific situation and temporarily have the kids continue to learn online until they can get back into school. And so, and we all have to, continue to do the same things that we've been talking about since March 8th and how we address the pandemic. And so, with the practices that we've been talking about from the very beginning.
One thing that a lot of the teachers and superintendents have said is they want, they're the ones also to have students in school. They're not sure if they can do it safely.
Yep.
If they have to have more students in school in order to comply with the requirement to have them in person for a certain number of days per week, but they don't have space or
Yep.
out the way they would want to, how are they supposed to accommodate what we're asking them to do, but also to do it safely so schools don't become a side effect?
So we're innovative, and we're, that's what we do here in Iowa. We're innovative, and we can adapt and be flexible in what we do. But I think, some of those concerns will be addressed in the recommendations and how we handle specific situations moving forward. So again, we're looking at what the criteria looks like. We're looking at what other areas, states and countries are doing. We're collecting the data, and then we'll provide some hopefully some more clarification and guidance that school districts can utilize moving forward. 1st of August is the goal. So I mean, they're working on it every day, but they're continuing to gather data, and we want to be in the best possible position that we can when we make the recommendations to our school districts. So I mean, they're late at night. They're constantly evaluating data and looking at the research and talking to other experts that are looking at the same things that our team is looking at. So it's on an ongoing basis, and we know that we need to get this information to you all as soon as we can. So they get that, and they're working really hard to be able to provide that. Well, that would be something that you would need to check with the director of the Department of Public Health. I don't micromanage our agencies. I'm not involved in personnel decisions, and so.
Was she giving out too much information?
No, I was not involved in that decision whatsoever. I believe well, it's personnel too, so I believe that you just need to talk to the director. I wasn't involved. I don't micromanage our agencies, especially don't get involved in personnel decisions, and so that's it. Yep. Well, I said at the beginning, schools can do it, and you're seeing that being discussed in school districts all across the state, so there's nothing that prevents them. It goes back to flexibility, local control. Maybe decisions will be different for our elementary kids versus the secondary and our high school kids. There's a lot of variations, and so that's something, again, there's some exceptions, or who's providing, how are they utilizing the mask, they can be contaminated when they're touch off, and so
those are decisions, and we can provide information that will be made at the local level as well, and based on what they're seeing in their school district, based on how, can they practice social distancing to the extent that we really would like to? Does that need to be, narrowed up because of space restrictions? And if so, then maybe, the mask is an option, or a face shield is something that they can take into consideration. So we want to put all those options on the table, and then, again, give them the flexibility to help design what best fits their need.
Another new report from the White House with Iowa in the red zone for new coronavirus cases. We had what looks to be a record number of new cases today. The report said that the states in this red zone should roll back reopening measures amid the surge in cases covered, and take that report into consideration before on to roll back and reopen.
Well, what we have done and will continue to do is to take a look at Iowa data and take a look at the trends and what's happening in the different areas that we're looking at. Our positivity rate yesterday, even with the numbers, was still 7.5%, way below the 30% where it was at our peak. But there's a lot of factors and metrics that we take into consideration when we're making those decisions. I don't know, Dr. Padotti, if you've got anything to add to that.
Yeah, I think that those pieces of information and guidance, it's data that we share with our federal partners and have regular conversations, again, about what's going on and expertise and experience at the federal, state, as well as local levels. And so part of what's important in public health and in epidemiology is to take a look at the trends that we see. And as I mentioned, part of what we've been seeing, like many other states over the past several weeks, is an increase among a young adult population in particular, who are not necessarily presenting severely ill, but those numbers are increasing. For example, when we look at the age distribution across the state of Iowa, the single highest age in years that's reported for cases here in Iowa is 21 years old, with over 1,300 cases. And so, it's important to keep in mind that we've got a lot of this young adult population who are understandably reporting when we do investigations that they're having a lot of social interactions in settings like bars and restaurants. And so what we do with that kind of information, we look at the big picture, we look at the national picture, the international picture, our state trends, but also our community and local trends to understand what are the recommendations and supports that we can offer and the messages that we can reinforce to help bring those cases down. Again, I think as we've all heard, we all have a role to play in helping to bring these numbers down. And so reinforcing among each other and taking opportunities like this as much as we can to reinforce the fact that we know this is hard, but staying home when you're sick, staying home when you've been a contact of somebody who has COVID for a full 14-day period, doing things like practicing social distancing, frequent hand washing, and using face coverings are all important things that we can continue to encourage each other to do to help to bring those numbers and transmission down.
I say thank you.